My name is Guillermo Pasarin, and I work at HCA Florida, neurosurgical specialist implantation. Most neurosurgeons tend to do a lot of spine, 70–80% of it. But the reason I got into it mainly was to do brains and brain tumors. The origin of my training was originally in vascular neurosurgery to do aneurysms and carotids and things like that. The scope of cranial surgery has diminished, and now most of my work has turned into spine, which is predominantly the decompression of nerves and spinal cord at the cervical, thoracic, and lumbar level. I'll do and have done some telemedicine during the COVID era, but I still think there's a certain value to sitting and standing in front of somebody and explaining things and diagramming, and it might be a little old school, but I think there's still the value to the spoken word, so we try and communicate as much as we can directly. And my belief is, and it's the way I was trained, is to avoid surgery if at all possible. Even though I'm a surgeon and that's how I make a living, I still feel that there's a benefit to trying everything possible to avoid surgery. When I walk in the room and you have this broad smile on the patient's face, and my leg pain is gone, or my arm pain is gone, and it's very satisfying. And then of course there's the people that literally can't walk, and you take a tumor out of their spinal cord and they're walking within a week or two later.